Right now, as you are reading this, somewhere a senior is being handed a small pill that will quietly, methodically begin erasing their memory. And here is the terrifying part. Their doctor told them it was perfectly safe. I am Dr. Michael, and in my years of medical practice, I have watched this tragedy unfold more times than I can count. A sharp, vibrant person walks into my office for a routine checkup, and only 6 months later, their family is asking me why grandma cannot remember their names anymore. Almost every time, the answer was sitting right there in her medicine cabinet. A landmark study published in JAMA Internal Medicine followed over 3,400 adults aged 65 and older. What they found should make every senior in America stop and think. Certain commonly prescribed medications increase your risk of dementia by up to 54%. This does not happen over decades. It happens within just a few years of regular use. Today, I am revealing the 9 most dangerous medications that are quietly triggering memory loss and cognitive decline in millions of seniors. I have ranked them from the commonly overlooked to the absolutely devastating. Number 1 on this list is not a single pill. It is something far more insidious that almost no doctor ever warns you about. Number 9, diphenhydramine, Benadryl. You know it as Benadryl. It is in almost every senior's medicine cabinet right now. That little pink pill you take for seasonal allergies, or to help you drift off to sleep. It is cheap, it is everywhere, and you probably think it is completely harmless. It is not. Benadryl belongs to a class of drugs called anticholinergics. These drugs block acetylcholine, the critical chemical messenger your brain absolutely depends on to form new memories and stay mentally sharp. As you age past 60, your brain naturally produces less of this chemical. Every dose of Benadryl pushes those levels even lower. A 2023 study in the Journal of Geriatric Cognitive Health found that seniors who regularly used anticholinergic drugs like Benadryl had a 54% higher risk of developing dementia. That is more than half again the normal risk from a pill most people consider a harmless sleep aid. What to do instead? If you need allergy relief, switch to loratadine, Claritin. It does not cross the blood-brain barrier and is dramatically safer for your cognitive health. And if any medication label says PM, nighttime, or sleep aid, check the ingredients. Chances are, it is just Benadryl hiding under a different name. Number 8, proton pump inhibitors, Prilosec and Nexium. Millions of seniors take PPs every single day for heartburn and acid reflux. Some have been on them for decades, and their doctors rarely mention what these drugs are doing to their brains. PPI do more than just reduce stomach acid. They systematically block your body's ability to absorb vitamin B12, a nutrient your brain desperately needs to protect tissue and maintain memory function. They also deplete magnesium and calcium, both essential for brain cell signaling. A groundbreaking study published in JAMA Neurology examined over 73,000 people aged 75 and older. Regular PPI users had a 44% increased risk of developing dementia. But it gets worse. PPIs have also been shown to increase amyloid beta plaques in the brain, the same toxic proteins that drive Alzheimer's disease. The fix. If you have been on a PPI long-term, talk to your doctor about tapering off with the help of an H2 blocker like famotidine, Pepcid, which is much safer for your brain. And please, have your B12 levels checked immediately. Number 7. Oxybutynin, Ditropan. This is frequently prescribed for overactive bladder and urinary incontinence. It seems practical. Nobody wants to deal with embarrassing bathroom emergencies. However, this medication crosses directly into your brain and attacks the same memory chemical, acetylcholine, that Benadryl does. In a comprehensive 2019 study in the British Medical Journal, seniors over 65 who took strong anticholinergic medications like oxybutynin for more than 1 year had a 49% higher risk of dementia. That is nearly 1 in every 2 users. The worst part is that the cognitive damage is almost always mistaken for normal aging. Brain fog, lost appointments, and misplaced keys are blamed on the calendar rather than the bladder pill. The alternative? Ask your doctor about mirabegron. Mirabetriq. It works through a completely different mechanism and does not block your brain's memory chemicals at all. Number 6. Statins, Lipitor, and Zocor. Statins are among the most widely prescribed drugs in the world. They lower cholesterol and reduce heart attack risk, and millions take them without a second thought. But here is the reality. Your brain is nearly 60% fat. Cholesterol is essential for building and maintaining the myelin sheath, the protective coating that helps nerve signals travel efficiently. When you aggressively lower cholesterol with powerful statins, you may also be starving your brain of what it needs to function. A 2023 study in Frontiers in Aging Neuroscience found that seniors over 70 who took statins for more than 3 years had a 26% higher risk of mild cognitive impairment. Some patients report sudden onset memory loss, forgetting familiar names, or even driving routes they have traveled for decades. What to know? Not all statins are equal. Pravastatin and rosuvastatin do not cross the brain barrier as easily and are considered safer. If you are noticing mental fog, do not wait until the damage becomes irreversible to have that conversation with your doctor. Before we continue, if you have found this breakdown of medications and their hidden risks helpful so far, consider liking the video, subscribing to the channel, and sharing it with someone who may be unknowingly putting their brain at risk. Number 5. Benzodiazepines, Xanax, Ativan, Valium. These are the pills millions take for anxiety and sleep problems. At first, they seem like a lifesaver, quieting racing thoughts and helping you drift off. But they are a trap. A 2022 study in the British Medical Journal followed over 8,000 seniors for 6 years. Those who used benzodiazepines for more than 3 months had a 51% increased risk of developing Alzheimer's disease. These drugs create a chemical sedation that progressively slows down your entire brain. It stops learning. It stops adapting. Seniors on benzos often describe feeling like they are moving through a constant fog. Safety warning. If you have been on a benzodiazepine for more than a few weeks, never stop suddenly. Withdrawal can be dangerous. Work with your doctor to taper very gradually. Buspirone or cognitive behavioral therapy can help restore calm without destroying your memory. Number 4. Amitriptyline, Elavil. This is an older antidepressant still commonly prescribed for chronic pain, insomnia, and migraine prevention. While it seems versatile, amitriptyline is one of the most potent anticholinergic medications still in circulation. It blocks acetylcholine so aggressively that cognitive decline is an expected consequence of long-term use. In the landmark JAMA internal medicine study, seniors who took higher cumulative doses of drugs like amitriptyline over 10 years had a 54% greater chance of developing dementia. The damage happens silently, looking exactly like normal aging, but being entirely drug-induced. Safer options. For nerve pain, ask about duloxetine or gabapentin. For sleep, try melatonin. For mood support, sertraline or escitalopram are dramatically safer for your brain. Number 3. Paroxetine, Paxil. Stop immediately. This one is especially deceptive because it looks like a modern, safe antidepressant. It is an SSRI, the same class as Zoloft or Lexapro, but paroxetine has a dirty secret that separates it from every other SSRI on the market. It has significant anticholinergic properties. In a 2021 review in Frontiers in Psychiatry, seniors taking paroxetine showed measurable declines in short-term memory and attention span within just 12 months. They were 30% more likely to show early signs of cognitive impairment compared to those on other antidepressants. The American Geriatric Society has officially placed paroxetine on its Beers criteria list of medications that are potentially inappropriate for older adults. The action step. If you are on Paxil, ask your doctor about switching to sertraline or escitalopram. Same benefits, but dramatically less risk to your memory. Number 2. Antipsychotics, Seroquel, Risperdal, Zyprexa. This one makes my blood boil. These are powerful drugs designed for severe psychiatric conditions like schizophrenia, yet they are being routinely prescribed to elderly patients in nursing homes for restlessness. Drugs designed for schizophrenia are being given to grandmothers just because they are confused at night and the staff wants them quiet. A 2022 study in The Lancet found that seniors prescribed antipsychotics were 71% more likely to develop worsening cognitive decline within just 12 months. These medications crush dopamine levels, making seniors appear dull, emotionally flat, and zombified. Families watch their loved ones fade away and assume it is the disease progressing. Often, it is the medication. The advocacy. If you have a loved one in care, ask the hard questions. Is this medically necessary, or is it for staff convenience? In most cases, structured routines and better lighting can manage behavioral symptoms without chemical sedation. Number 1. Anticholinergic polypharmacy. You might have expected a single pill to top this list, but the most dangerous threat is what happens when you take multiple anticholinergic medications at the same time. This is called polypharmacy. Picture this. A senior takes Benadryl for sleep, oxybutynin for bladder control, and amitriptyline for chronic pain. Each pill alone causes mild issues, but together they compound exponentially. A 2022 analysis in Age and Aging tracked over 280,000 adults and found that those with the highest anticholinergic burden had a 120% increased risk of developing dementia. That is more than double the normal risk. The empowering truth. Drug-induced dementia is often reversible when caught early. When the medication burden is lifted, many seniors regain mental clarity and memory function within weeks. Your brain is remarkably resilient, but only if you give it a chance. Your immediate next steps. Do not wait for the fog to get thicker. Do not assume your memory loss is just aging. It might be your pills. Here is what you need to do right now. Request a med review. Ask your doctor or pharmacist to review every single medication you are taking, including prescriptions, over-the-counter drugs, and supplements, for their anticholinergic load. Calculate your score. There are tools that calculate your total burden score. If yours is high, work with your doctor to deprescribe safely. Switch to alternatives. Identify the problematic drugs and transition to the brain-safe alternatives we discussed today. Your story could help another senior avoid this same trap. Tell me your thoughts in the comments. Like this video and subscribe to the channel. I am Dr. Michael, and I believe your health is your greatest asset. Your brain is worth protecting. I will see you in the next one.